Does daily masturbation affect prostate health? This is a question that sparks curiosity in many men but is often left unexplored due to discomfort or social stigma. In this video, Dr. James Walker, a men's health specialist, offers a clear, science-based, and judgment-free explanation to help shed light on this topic. Masturbation is a natural physiological behavior practiced by most men. However, it is surrounded by numerous misconceptions such as masturbation causes infertility, it leads to physical weakness, or it harms the prostate. Dr. Walker emphasizes that it's time to move past these misunderstandings with accurate medical knowledge. He begins by explaining the role of the prostate, a small yet vital gland in the male reproductive system. He then cites large-scale studies from prestigious universities, most notably a Harvard study, which found that men who ejaculated frequently, at least 21 times per month, had a 31% lower risk of developing prostate cancer compared to those who ejaculated less often. Additionally, Dr. Walker highlights that moderate masturbation helps reduce stress, regulate hormone levels, and improve the quality of one's sex life. However, he also warns about the risks of overuse, especially when masturbation becomes compulsive and starts interfering with work, relationships, or mental health. In summary, Dr. James Walker delivers a clear message. Daily masturbation is not harmful as long as it is practiced in moderation, with awareness, and in respect of one's own body. What is the prostate and why is it so important for men's health? When it comes to male reproductive and sexual health, one of the most essential yet often overlooked organs is the prostate. Although it's only about the size of a walnut, this small gland plays a critical role in the male reproductive system. Its function significantly impacts overall health and fertility, especially as men age. Location and primary functions of the prostate. The prostate is located just beneath the bladder and surrounds the upper portion of the urethra, the tube that carries urine and semen out of the body. Its most important role is to produce the majority of the fluid found in semen, a nutrient-rich liquid that nourishes and protects sperm during ejaculation. More than just a tube, the prostate is like a vital factory that ensures sperm have the best environment to travel and fertilize an egg. Impact on fertility and overall health. A healthy, functioning prostate is directly linked to male fertility. When the prostate performs well, the semen produced is plentiful and of good quality, helping to safeguard sperm and enhance the chances of successful conception. Additionally, the prostate plays a role in regulating urination through the muscles surrounding the urethra. As such, one of the earliest signs of prostate issues often involves changes in urination habits. Common prostate conditions. Over time, the prostate is prone to several health issues, particularly in men over the age of 50. The three most common conditions include benign prostatic hyperplasia, BPH. This refers to non-cancerous enlargement of the prostate, which can compress the urethra and lead to urinary difficulties, frequent nighttime urination, or weak urine flow. Prostatitis. Often caused by bacterial infection or trauma, this condition can result in painful urination, discomfort in the lower abdomen or perineum, and sometimes fever. Prostate cancer. This is the second most common cancer among men, especially those over 60. Though it usually progresses slowly, it can become dangerous if not detected and treated early. Why men should take prostate health seriously early on. Proactively caring for your prostate from a younger age can help prevent serious complications later in life. Key preventive measures include maintaining a balanced diet, exercising regularly, engaging in healthy sexual activity, and undergoing routine medical tests such as the PSA, prostate-specific antigen test, and digital rectal exam, DRE, starting at age 45 or 50, depending on risk factors. Though small in size, the prostate's importance cannot be overstated. Taking care of it is foundational for a healthy sex life and a disease-free old age. What does science say about ejaculation frequency and the risk of prostate cancer? Over the past several years, the scientific community has actively studied the relationship between ejaculation frequency, including both masturbation and sexual intercourse, and prostate health, especially regarding the risk of developing prostate cancer. One of the most comprehensive and influential studies in this field comes from Harvard University. Published in 2016 in European Urology, one of the leading urology journals in the world, this research provides valuable insights that challenge outdated perceptions. The Harvard study followed over 31,000 men across a span of 18 years, and the findings were surprisingly positive. According to the study, men who ejaculated at least 21 times per month had a 31% lower risk of developing prostate cancer compared to those who ejaculated only 4 to 7 times per month. This figure is highly significant, especially when it comes to preventing one of the most common and potentially dangerous types of cancer among middle-aged and older men. Why is frequent ejaculation beneficial for the prostate? To explain this correlation, scientists suggest that regular ejaculation acts like a natural cleansing mechanism for the prostate. During ejaculation, the prostate expels the fluids it produces, which may help remove inflammatory substances and other compounds that could potentially contribute to cellular abnormalities. By clearing out these materials, the body reduces the likelihood of chronic inflammation, a known risk factor for cancer development in the prostate. Additionally, every time a man reaches orgasm, the body releases a surge of beneficial hormones such as endorphins and oxytocin. These hormones promote relaxation, stabilize mood, and regulate hormone levels. Chronic stress, which is known to suppress immune function and increase inflammation, is considered a contributing factor to many prostate-related problems. Therefore, regular ejaculation may indirectly help protect the prostate by mitigating the harmful effects of stress on the body. It's not just Harvard's research that supports this idea. Another study, published in 2017 in the Journal of Sexual Medicine, echoed similar findings. It concluded that men who maintained regular ejaculation patterns during their 20s and 30s were less likely to develop prostate cancer later in life. This supports the notion that the benefits of healthy sexual habits can accumulate over time and play a preventative role in long-term prostate health. Conclusion of the research. Taken together, current scientific evidence suggests that regular ejaculation, including through healthy masturbation practices, is not harmful. On the contrary, it may provide meaningful benefits for prostate health, particularly in reducing the risk of cancer. However, as with all things related to health, balance is key. Regular ejaculation should be just one part of a holistic lifestyle that includes a nutritious diet, physical activity, stress management, and routine medical checkups. It's time to bust the myth around masturbation and men's health. In many cultures, masturbation has long been associated with shame, guilt, or perceived weakness. These stigmas not only lead to unnecessary feelings of embarrassment, but also contribute to serious misunderstandings about sexual health. From a modern medical perspective, many long-held beliefs about masturbation are inaccurate and need to be corrected. Myth number 1. Masturbation causes infertility. This is one of the most common concerns, especially among younger men. However, science has proven that masturbation does not reduce sperm count or quality. The male body produces millions of new sperm daily, and ejaculating through masturbation merely releases sperm that has already been produced. Infertility in men is usually linked to more serious underlying causes such as hormonal imbalances, testicular damage, or medical conditions, not the act of masturbation. Myth number 2, masturbation weakens the body. Many people believe that masturbation causes fatigue, weakness, or loss of vitality. In truth, there is no scientific evidence to support this. On the contrary, orgasms trigger the release of hormones such as endorphins and dopamine, which help reduce stress, elevate mood, and support better sleep. When done in moderation, masturbation can be a way to relax and enhance emotional well-being. Myth number 3, masturbation prevents all prostate problems. While numerous studies have shown that frequent ejaculation may reduce the risk of prostate cancer, this doesn't mean it can prevent all prostate-related conditions. Other issues like prostatitis, inflammation of the prostate, or benign prostatic hyperplasia, BPH, or non-cancerous enlargement of the prostate can be influenced by factors such as age, diet, lifestyle, genetics, and overall health. Masturbation alone is not a universal solution for maintaining prostate health. Reframing the narrative. Dispelling these myths is not just about eliminating stigma. It's about empowering men with knowledge and helping them make informed decisions about their health. Understanding that masturbation is a natural and normal part of male sexuality is an important step toward better sexual health and self-acceptance. That said, healthy sexual behavior must always be part of a broader approach to wellness. Diet, exercise, regular medical checkups, and mental health care all play critical roles in protecting the prostate and maintaining sexual vitality. Masturbation is one helpful piece of the puzzle, but it is not a miracle cure or a replacement for a healthy lifestyle. When does masturbation become a problem? In most cases, masturbation is a natural and completely normal physiological behavior, especially when practiced in moderation and with awareness. Many men maintain a daily habit of masturbation as a way to relieve stress, improve sleep, or support a healthy sex life. However, like any repetitive behavior, masturbation can become problematic when it exceeds healthy limits and begins to negatively impact physical, emotional, or social well-being. The first red flag: disruption to daily life. The first sign that masturbation may be becoming a problem is when it starts interfering with your work, social interactions, or daily responsibilities. If you find yourself constantly delaying tasks, avoiding social activities, or feeling guilty and ashamed after each session, it may indicate that the behavior is becoming compulsive or out of control. When masturbation starts to replace real-life relationships or becomes a central focus of your day, it's no longer a healthy practice. Physical discomfort and sensitivity. Another warning sign is physical discomfort. If you often feel soreness in the genital area, heightened sensitivity, or begin to have difficulty reaching orgasm or maintaining sexual arousal with a partner, your frequency of masturbation might be too high. While these symptoms are often temporary, if they persist, it may be time to reduce the frequency and seek professional guidance if needed. The impact of pornography overuse. Excessive consumption of pornographic content is also a factor that can distort expectations about sex. When the brain becomes accustomed to intense and unrealistic stimulation from porn, real-life sexual experiences may seem less satisfying. This disconnect can affect intimacy, create dissatisfaction in relationships, and lead to emotional isolation. The key: balance and awareness. Ultimately, masturbation only becomes an issue when it crosses the line from being a healthy outlet to a disruptive or compulsive behavior. Every person needs to listen to their body and observe their emotions and patterns to recognize any red flags. The key here is balance between natural sexual needs and a healthy, socially, and emotionally fulfilling lifestyle. If you ever feel that masturbation is negatively impacting your life, or that you're losing control over the behavior, don't hesitate to seek help. Talking to a urologist, sex therapist, or mental health professional can provide clarity and support without judgment. 5. Practical tips to keep your prostate healthy. The prostate is an essential part of the male reproductive system. When we're young, most of us pay little attention to this small gland. But as we enter middle and older age, problems like benign prostatic hyperplasia, BPH, prostatitis, and even prostate cancer may start to emerge. Taking proactive steps early on can help prevent or slow the progression of these conditions. Below are 5 simple, yet highly effective tips you can incorporate into your daily life to help maintain optimal prostate health. Maintain a healthy and balanced diet. Diet plays a crucial role in prostate health. Studies have shown that men who consume a lot of lycopene, a powerful antioxidant found abundantly in cooked tomatoes, have a lower risk of developing prostate conditions. In addition, fatty fish such as salmon and mackerel, which are rich in omega-3 fatty acids, can help reduce inflammation. Incorporate a variety of nuts, green vegetables, fruits, and whole grains into your daily meals. These foods provide essential vitamins and minerals while promoting a healthy inflammatory response in the body. At the same time, limit your intake of red meat, fried foods, and processed products, as they may increase the risk of chronic inflammation, a contributing factor to prostate problems. 2. Exercise regularly, at least 30 minutes a day. Physical activity is not only good for your heart, but also helps improve blood circulation and reduce inflammation, both critical factors in maintaining a healthy prostate. Choose an activity you enjoy, such as brisk walking, swimming, or cycling to stay consistent. Don't forget Kegel exercises, which are often recommended for women but also benefit men. These exercises strengthen the pelvic floor muscles, improve urinary control, and enhance sexual function. 3. Get regular health checkups and monitor prostate markers, starting at age 50 or age 45 if you're at higher risk, such as having a family history or being of African descent. You should begin regular screenings. These include the prostate-specific antigen, PSA, blood test, and a digital rectal exam, DRE. These basic tests help detect early signs of prostate issues, including cancer. Early detection dramatically improves treatment outcomes. 4. Manage stress proactively. Chronic stress weakens the immune system, disrupts hormonal balance, and increases the risk of chronic inflammation, all of which can contribute to prostate disease. Set aside time each day to unwind, whether it's through meditation, yoga, listening to music, reading, or pursuing other healthy hobbies. Mental health is just as important as physical health. Prioritizing your emotional well-being is a vital part of comprehensive self-care, especially as you age. 5. Communicate openly with your partner about sexual health. One often overlooked factor in maintaining prostate health is a healthy sex life. Moderate, regular sexual activity, including masturbation, can help reduce the risk of prostate disease. But more importantly, open communication with your partner about your sexual needs, preferences, and any challenges fosters intimacy, understanding, and emotional connection. A strong emotional bond and mutual support contribute to a positive mental state, which in turn supports hormonal balance and overall sexual health. Final thoughts. By consistently applying these 5 practical tips, you'll build a solid foundation for lifelong prostate health. This not only protects your physical well-being, but also supports mental clarity, emotional balance, and overall performance as you age. Daily masturbation. Real benefits, but only with moderation and understanding. Masturbation is a natural physiological behavior, commonly practiced by most men. When done in moderation, it can offer clear benefits for prostate health. Numerous reputable scientific studies have shown that frequent ejaculation, including through masturbation, may help reduce the risk of prostate cancer by supporting the natural cleansing of harmful substances that accumulate in the gland. Moreover, reaching orgasm promotes the release of positive hormones such as endorphins and oxytocin, which can lower stress levels, improve sleep, and help regulate hormones. Masturbation is not a miracle cure. However, it must be emphasized that masturbation is not a magic solution or the only method for protecting the prostate. If you rely solely on it while neglecting other essential aspects such as nutrition, physical activity, regular checkups, and mental health care, you're missing out on the full picture of sustainable wellness. Maintaining a healthy prostate requires a comprehensive lifestyle approach. Ejaculation is just one part of the equation. An important one, yes, but not the entire answer. Know your own limits. The most important factor is understanding your body and knowing your own healthy limits. If masturbation helps you relax, feel good, and doesn't interfere with work, relationships, or physical well-being, then it's likely a normal part of your personal routine. However, if you feel that masturbation has become compulsive, makes you feel drained or isolated, or negatively impacts your sexual function, it may be time to reassess your habits and seek professional support. Never be afraid to ask for help. Never hesitate to talk to a urologist, a mental health counselor, or a qualified sex therapist if you have concerns or questions about your sexual behavior. Sexual health is a vital component of overall male wellness, and caring for it should never be dismissed or hidden out of embarrassment or fear. In summary, daily masturbation can absolutely be part of a healthy lifestyle when practiced with awareness, moderation, and within the context of an overall healthy life. It's time to replace outdated myths with science-backed knowledge and to treat self-care, including sexual self-care, as a vital aspect of long-term well-being. Whether you're in your 20s, 50s, or beyond, understanding how your body works and what it truly needs is the key to staying strong, confident, and healthy throughout life.